If you suffer from hemorrhoids, you know how uncomfortable and painful it can be. But what if we told you it's possible to alleviate the symptoms without needing surgery? That's right. Today, we're going to explore what hemorrhoids are, how to prevent them, and how to treat the symptoms without the need for a surgical procedure. So, if you want to understand more about hemorrhoids, find out how to avoid surgery, and learn about important dietary tips and treatment, stay until the end of the video. We have a super tip that you will love. Hello. Very nice to meet you. My name is Daniel. I'm a medical student, and you're watching another video from the Animation Health channel. Before we begin, don't forget to subscribe to the channel, leave your like, comment, and share this video. This is very important so that we can continue to disseminate valuable information to everyone. Let's start by explaining what hemorrhoids are. They are dilations of the veins in the anal region that can cause discomfort and pain. And don't think you're alone in this. It's a very common condition, but many people suffer in silence because of the stigma associated. There are several symptoms that can indicate hemorrhoids, and it's important to be aware of all of them. Pains and bleeding can occur when defecating, and some patients may notice a kind of swelling or prolapse on the outside of the anus, which resembles a small blister or nodule. Some people report feeling something descend and then return on its own inside the anal canal after defecation. In other cases, manual assistance may be necessary to reintroduce the prolapsed hemorrhoid. Another common symptom is anal itching, technically known as anal pruritus, which can be an indication of hemorrhoidal disease. And finally, the presence of a clear mucus can be a sign of hemorrhoidal disease. However, the most common is bleeding, usually with a very vivid, bright red blood, or the presence of something unusual in the outer region of the anus, which can indicate an external hemorrhoidal disease. Nevertheless, it's crucial to remember that you should not diagnose yourself. If you have any of these symptoms, even occasionally, or it seems something light, it's essential that you seek a doctor. Although you may think it's just a hemorrhoid, the problem could be much more serious, like rectal cancer, an anal fissure, or a fistula. Hemorrhoidal disease is classified into 4 degrees, depending on the severity and location of the hemorrhoids. Hemorrhoids of degree 1 and 2 are inside the anus and can self-revert, while those of degree 3 and 4 are outside the anus and are visible, and may require surgical intervention. Now that we understand better what hemorrhoids are and their symptoms, I want to share some care and tips to avoid worsening this condition. 1. Diet. Avoid foods that can make stools more acidic, as this can irritate the anal area. Some of these foods include ready-made spices, pepper, bell pepper, industrialized tomato sauce, garlic, popcorn, peanuts, excessive chocolate, and alcoholic beverages. On the other hand, opt for fiber-rich foods, such as whole grains, vegetables, fruits, and greens. They help soften the stools and facilitate bowel movements, reducing discomfort. 2. Hydration. Drinking plenty of water is essential to keep the stools soft and easy to pass. This can help reduce pressure and strain during bowel movements, minimizing the risk of hemorrhoids. 3. Hygiene. Excessive use of toilet paper can cause friction and hurt the anus. Try using a bidet or a bath to clean the area after bowel movements. This could be a gentler option. When drying, avoid rubbing, instead, lightly pat to dry the area. 4. Movement. Avoid sitting for a long time, especially on the toilet, as this can increase the pressure in the anal region. Incorporating regular physical activity into your routine can also help promote healthy digestion and reduce the risk of constipation. 5. Body weight. Maintaining a healthy weight can also prevent hemorrhoids, as excess weight can increase abdominal pressure and, consequently, pressure on the veins in the anal region. 6. Avoid lifting heavy weights. Lifting heavy objects can increase pressure on the anal veins and contribute to the development of hemorrhoids. 7. Take breaks. If your job requires you to sit for long periods, take regular breaks to get up and walk a little. This can help relieve pressure in the anal region. There are several treatment options that can help alleviate symptoms and avoid the need for surgery. Acupuncture, for example, can relieve symptoms by stimulating specific points on the body. Topical ointments, which contain medications that help reduce inflammation and swelling, are also a useful option. Another effective home treatment is a warm water sitz bath, which can be complemented with medicinal plants such as chamomile, lavender, arnica, and witch hazel. I hope this information has been useful to you. Remember, nobody needs to suffer in silence with hemorrhoids. There are several treatment options available, and simple lifestyle changes can make a big difference. Don't forget to leave a like and subscribe to the channel. Comment if you've suffered from hemorrhoids and share your experiences and tips. See you in the next video.